evening, and thank you for joining us for this evening's Community Leader Call. My name is Tomas Salamantes, Deputy Chief of Staff to Mayor Muriel Bowser, and I want to thank you all for joining us for our first Community Leader Call as we discuss of 2021, as we discuss the district's COVID response and recovery efforts in Washington, D.C. We will be joined by Dr. Ankur Shah, who is the Deputy Director at DC Health, as well as Clint Osborne, who's Operations Lead over at DC Homeland Security and Emergency Management Agency, who will answer your questions related to the district's coronavirus response and recovery efforts. We want to remind everyone about a few housekeeping items before I hand it over to Dr. Shah, who will be providing some updates on the district's vaccine plan. But want to remind everyone, again, if you are on the phone, joining us by phone, you can press 0. Again, that number is 0 now to let people, or to get entered into the question queue so we can let people ask questions. So again, you press 0 to be entered into the question queue. I want to remind people also, if you're watching online through one of our streams on Facebook or Twitter, you can quickly ask your questions directly on the streams related to our coronavirus efforts, and we'll get to some of those questions during the Q&A. So again, if you are by phone, you can press 0 now, or if you to be entered into the question queue, or you can ask on our live stream on Facebook or Twitter. So, but again, just want to remind everyone that we are going to be hearing from Dr. Shah now on the vaccination plan and updates, and you can go to coronavirus.dc.gov/vaccine to learn more about what Dr. Shah is about to update us on. So, Dr. Shah.
Thank you, and good evening, everyone. So today, I would like to spend a few minutes to talk about the vaccines that we have for COVID-19, and then our process here in the district and where we are right now, and then take some questions as well. So just to recap, there are 2 vaccines available for COVID-19. One is by Moderna, the other one is by Pfizer. For our intents and purposes, both of them have the exact or nearly the same effectiveness, about 95% effective in preventing COVID-19, which is kind of incredible. And both of them have the same immune response profile. What that means is how your body feels a day or two after having this type of vaccination. And what is common in both of these vaccines is that you are likely to have your arm feel sore, and then mostly after the second shot, but even after the first shot, you are likely to have some soreness, some muscle aches, maybe some fever. That is absolutely expected. It lasts about a day or two, and then you're back to normal. And right now in the district, both of those vaccines are available in different routes. The Pfizer vaccine is mainly within our hospitals right now, and that's just because it requires ultra-cold storage. The Moderna vaccine doesn't require that, and we've actually are able to distribute it a little broader areas across the district. And we have multiple access points. And that leads me to where we are operationally right now. In December, we started having the Pfizer vaccine coming into the district and working on our phase 1A population, healthcare workers. Those are in the front line, really treating patients with COVID-19 and not COVID-19. And we've been doing a great job vaccinating them, starting with our acute care hospitals and spreading out to other healthcare facilities as well. Also, now by the end of December and now throughout January, we've been vaccinating individuals, staff, and residents in nursing homes and assisted living facilities. That started now and will continue through January as well. And then what's really fantastic for district residents at large, and specifically healthcare workers that aren't affiliated with any of these hospitals, is that we have a portal for easy access and scheduling for vaccines, and that is vaccinate.dc.gov. I'm going to repeat that, actually. Vaccinate.dc.gov. And this is a way currently for healthcare providers, log on, put in some information, and can schedule an appointment. And that's because we made partnerships with Safeway pharmacies, Giant pharmacies, and a handful of our federally qualified health centers, specifically Unity Healthcare, Mary Center, Bread for the City, and Community of Hope. And what we see moving forward is we're going to open this site up for our next priority group. I encourage everyone to tune in Monday at 11 a.m. for the mayor's press conference. That's where we're going to have an update for what's coming up next in the utilization of this portal to get vaccine for our next group, which, as you know, from this past Monday, we're looking to increase access for district residents who are 65 years and older to get vaccinated as well. I'll stop there and invite questions and happy to talk a little bit more either about what our plans are for the rest of January or talk more specifically about the vaccines in particular.
Thank you, Dr. Shaw. I know I already see a bunch of questions coming in on the phone, and I know we'll have some more coming in online as well. So again, before we get into some of our first questions, I want to remind everyone, if you're joining us by phone, it looks like we keep having more and more people joining us, which is exciting. You can press 0 now to be entered into the question queue, or if you're watching on Twitter or Facebook, you can ask your questions directly there, and we'll get to some of those online questions. So the first question I'm going to go to today is from Claudia in Ward 6. Claudia, your line is unmuted.
Thank you so much for taking my question. I was just wondering when and where citizens 65 and older will get the vaccine.
Great question, and thank you for that. So residents 65 and older, the process for getting the vaccine will be through the same website, Vaccinate.dc.gov. Our goal is by next week, you could use this portal to actually identify yourself as a district resident above 65, and then to schedule appointments quite easily at locations across the district. This includes not only Safeway pharmacies and Giants, but also some other off-site locations that are geographically easier to get to, and a few more of our clinical sites as well that we're hoping to have, or we will have, hours in the morning, in the afternoon, in the evenings, and on the weekends. Also, there will be a call center likely launched next week as well that will help facilitate getting those appointments scheduled, answering some of those questions, especially sometimes websites don't act right, and it's great to get someone on the phone to talk through it, and we're going to have that infrastructure in place too for it. And that will all be through the portal as well that can show you all those locations of where it is. There'll be availability in every ward.
Thank you, Dr. Shaw. I'm going to go to our first online question, which is, if I secure a vaccine appointment when it's my turn, what do I need to bring to the vaccination site? Any sort of documentation? What should I expect?
Another great question. So after you make your appointment, you'll get an email confirmation as well that you could bring or show at the time of appointment. Also, we are requiring a verification. So if you're a healthcare worker, for example, show that you are a healthcare worker. However, we don't want to be really prescriptive about what this looks like. Our recommendation is it can be something as simple as your ID badge if you're a healthcare worker. If you are a resident over 65, then that could be your ID, for example, or something else. If you don't have an ID, that shows that you are fitting in that category as well. So we're kind of keeping it a little more flexible just to make sure we accommodate everyone who might not have that specific type of verification on hand that you might need. Also, I do want to make an important point that this portal is for first dose appointments only. So both vaccines that we have right now are 2-dose series. So say I make an appointment at the Community of Hope or Mary Center Clinic. I go there, get my vaccine. At that time, within the clinic, I schedule my second dose appointment at whatever time works within the schedule at the clinic in your own schedule 28 days later. The reason why that is because of how deliveries work with vaccines. First dose are tied to second doses. Also, you're within that provider system, they could send you a second dose reminder as well. So that's a pretty important, in our early rollout of this website, there might have been some confusion about using the portal for second doses. It's only for first doses.
Great. Thank you, Dr. Shaw. We're going to go next to our next question. We're going to go to Commissioner Gail Brevard. Commissioner, your line is unmuted.
Hi, good afternoon. I'm calling regarding those citizens who have allergies and who are reluctant to take the shot because of their concern of a severe allergy reaction. And I'm speaking about those who have to carry Benadryl or EpiPen with them at all times. Some have mentioned to me that they have heard that once you get the inoculation, you would have to download an app on your phone, or you would be given a hard copy of a certificate indicating that you have been inoculated, so that if you're challenged by, say, TSA or merchant, you just show them your proof that you've been inoculated. But those with allergies, first of all, is that true that there's some sort of certificate that you would have to get to show proof, if challenged, that you've had the inoculation? And how would this be handled in cases where folks cannot get the shot because of their serious allergies?
Thank you for the question. Both questions. So I'll take the one around the certificate. When you get your first vaccination, you will get a card saying that the date you were vaccinated, but this is purely for your own record keeping and in order to keep track of your second dose as well. There is no intention and no process right now that you need to show that you are vaccinated to get into any sort of system or essential services or non-essential services right now. And there is no mandate among that DC Health is recommending for this vaccine for any sort of setting. It's purely voluntary. But we do highly, highly encourage it because we think this is our solution and our way out of this horrible tunnel. For your second question about the allergies, so there are two what we call contraindications to the vaccine, and one is if you've had a severe allergic reaction to this vaccine. So if you took the vaccine and you had a severe allergic reaction, then you probably shouldn't take it again, or if you've had a severe allergic reaction to the components of that vaccine. It's important to note that this vaccine does not contain egg, and that's where some egg allergy sometimes falls with vaccine allergies. And all our vaccinators went through a process of getting approved to be a vaccinator. So they have on hand what they need to make sure if someone has an allergic reaction, they get the medicine, the EpiPen, whatever they need to make sure they're safe. So anywhere you're getting vaccinated, they have been approved to do that. And and you should also tell the vaccinator if you've had a history of allergies or severe allergic reactions to vaccines, and they would just monitor you now for 30 minutes as opposed to 15 minutes after vaccine. It's still safe to get vaccines even if you've had allergies to vaccines in the past. That's just something you need to talk about with your provider at the time of visit.
Thank you, Dr. Shaw. We're going to take a online question now. This one is from Lakita Thomas on our Facebook stream. Hi, Lakita. Is the vaccine safe to be given to patients that have had COVID?
Yes. Short answer, it is safe. If you had your coronavirus, if you were currently positive or in quarantine or isolation, then we recommend that you do not get the vaccine until you're out of isolation or out of quarantine. And that is mainly to ensure the safety of others when you're getting vaccinated. We're trying to maintain social distancing, keep crowds small, but also if you could delay it a week after you or 2 weeks after you get out of isolation, that's what we recommend.
Great. Thank you, Dr. Shaw. We're going to go next to Dr. Kraskin on the line from Ward 3. Dr. Kraskin?
Yes, thank you for taking the question. I am chair of the D.C. Board for Optometry, and we appreciate the vaccinations, and many of my colleagues, including myself, have gotten their vaccine. But, Dr. Shaw, you actually answered a moment ago about second dose. And the question that I have is, how do you arrange the second dose? I personally had mine at a Safeway. Another colleague had it in a different Safeway. Nobody asked or made any point of scheduling that second dose. Are we supposed to contact where we got our initial dose, or how do we do this?
Thank you for the question. Yes, so the provider who gave you the first dose should schedule the second dose. But you're right, in that first couple weeks, and there's some locations in which some of those pharmacists may have forgotten that process, and it is a new process that they are instituting. So we did identify there are some people that did not get notified or did not get scheduled their second dose. How we've been working with our providers and partners is for them to identify those individuals, to call them, and so to call you as well and reach out to schedule that second dose as well. So all those individuals that in those first couple weeks, some of the pharmacists or providers forgot that this is part of their process to schedule their second dose. We're working on a system to make sure they get a callback. Also, once our call center is up, that'll be another avenue in which we can help coordinate that as a district to that provider site, so your Safeway, for example, to ensure that your second dose is scheduled through them. And I do appreciate everyone's flexibility in terms of how we rolled out this kind of very massive and wide access program overnight for our healthcare workers and soon for individuals over 65. It's a partnership. It's a public-private partnership with our pharmacies and our clinics. And in those relationships, we're all learning at the same time and sharing best practices and trying to figure out the best ways to work together.
Thank you, Dr. Shaw. I'm going to go to our next online question. Where do food workers, such as those working in restaurants or in fast casual locations, when are they eligible for the vaccine in the proposed timeline?
Thank you for that question. So those workers, and this is a great time to actually talk about essential workers, because this question will always come up. What is the definition of essential worker? And this is something that has a clear definition through the federal government, through our district government as well. But I think about it very simply, and that is if you had to show up to work in person during this public health emergency. If you had to do that, you're an essential worker, and that means you're part of Phase 1A. Phase 1A has a lot of different mini phases throughout it, gating criteria, I sometimes call it. For example, this next gating criteria is those 65 and above. Later in the month, we're going to focus on those frontline essential workers in very specific settings, such as public safety, grocery stores, pre-K through 12 educational settings, and childcare settings. So we'll have these continual gating criteria, but for the question at hand, as an essential worker, you will be in Phase 1. The exact timeline we are unsure of, but we will let you know through multiple methods. One is coronavirus.dc.gov and then /vaccine. The Monday morning press conferences at 11 a.m. by Mayor Bowser is a great way in which new vaccine update information will be shared also.
Thank you, Dr. Shaw. We're going to go next to Karen Benola in Ward 5. Karen, your line is unmuted. Again, Karen Benola in Ward 5, your line is unmuted.
Okay. Can you hear me now?
Yes, we can.
Okay, great. I wanted to ask if it would be suggested to take the test before getting the vaccine or not.
Thank you for your question. And no, you do not need to take a vaccine, you do not need to take a test before the vaccine. We do want you to take the vaccine. The reasons to take a test or a COVID-19 test would be if you, are feeling symptoms at all, then we definitely want you to get tested, or you feel you've had a close contact exposure, or you were involved in a recent high-risk activity where you could have been exposed to COVID-19 as well. And there's public testing sites throughout the city as well as throughout through your provider. Again, those testing sites are available at coronavirus.dc.gov.
Thank you, Dr. Shaw. We have we're at the 9-minute mark left on today's call. I'm trying to get to as many questions as possible, so I want to just remind, if you are not in the question queue yet, you can press 0. Hopefully we will have some time to get to as many as possible. But we're going to go next to Jacqueline Muir in Ward 2. Jacqueline, your line is unmuted.
Thank you. Will CVS and Walgreens, will they have the capability to do this once for the 65 and older?
Yes, they will be part of our vaccine plan. Right now, a lot of their time is focused on going into the nursing homes and assisted living facilities. But I expect as the weeks go along and in the next month, we will have Walgreens stores and CVS stores being available to administer vaccine as well. A lot of it is based on how much vaccine we receive from the state or from the federal government, which is still not that much. So it's not as though we could even spread it out that much if they were online right now.
Thank you for that great question. We're going to go to Sahul Ephelbaum. Sahul, your line is unmuted.
Yes, I am here. Hello?
Yes, we can hear you. Go ahead with your question.
Yes, my question is, you said that when you receive the vaccine, after the vaccine is injected, you will have some fever, you will have some pains. Do you have to act to that and take a Tylenol or rub some aloe vera or something?
Thank you for the question, and it helps me clarify my comment as well. So you could take both vaccines and not have any sort of pain or any sort of immune response a day or two after. In the clinical trials, we saw somewhere around the range of 75 to 80% of individuals who do have some pain and soreness in their arms, and then maybe around the 70-ish percent, 70 to 80% range of people who might have some nausea, some muscle aches, or slight fever as well afterwards. When you do feel that, you can and should take Tylenol, Advil, or put aloe vera, as you mentioned, whatever you think will make you feel better over the counter, or talk to your doctor. However, at this point, it is not recommended to take Tylenol or Advil before you get the vaccine. What we call pre-treating. The CDC and DCL, we do not recommend pre-treating before the vaccine because that hasn't been studied.
Oops, sorry about that. I was still muted. We're going to go next to Alicia Horton in Ward 1. Alicia, your line is unmuted.
Great. Thank you so much. Yes, Alicia Horton. I'm Executive Director at Thrive DC. We're a homeless services, social services agency in Ward 1. So my question is really around what processes are you all thinking of or putting in place to make sure that the very vulnerable homeless community is able to get vaccinated, and also my staff and others who are working with them.
Thank you for the question. And that actually leads me to the other part of our plan that's occurring right now, which is special congregate care settings, in which we're working with specific our partnered sister agencies, such as Department of Human Services, as well as the Department of Behavioral Health, for example, to identify other congregate care areas in which we need to figure out how to vaccinate those group of people, which means bringing a vaccinator to those settings as well, and inclusive of homeless, the homeless or in housing and transitional housing community. So in short, those communities are high priority. We are actively working through plans to vaccinate them, which should occur within the next few weeks as well. So it's just finding those vaccinators or developing a system to have those individuals come and get vaccinated as well is occurring. And then for your staff, since they are working during the public health emergency, they are
thank you, Dr. Shaw. We're going to go next to Monica Healy in Ward 3. Monica Healy, your line is unmuted.
Thank you very much, and I really appreciate Mayor Bowser making 65 and older a priority. My question is, I assume we will find out at her press conference on Monday, or we may find out when we will be eligible to actually schedule an appointment. So going to that, if we go into the portal and we try to schedule an appointment next week, will we be guaranteed a vaccine? Or, in other words, do you have enough doses for all seniors who want to sign up?
Thank you for the question. So right now, if you are 65 and above, we do not want you to use the portal. The portal isn't set up yet for 65 and older. It's currently set up for healthcare workers. When we, at the press conference, we'll have information about that week, how we're opening it up for 65 years and older, and the methods to schedule and make an appointment. If you make an appointment, there'll be a vaccine on that other end. That's what we are guaranteeing that, and we're creating as many appointments as possible. For example, this past week we've had 10,000 appointment slots as well. So we are leveraging our vaccine that we have to create as many appointments as possible, and then they're going to continue. If not this week, then the following week, and so on. So we are committed to serve the 65-year-old population up for as much demand there is before thinking about the next gating criteria.
Thank you, Dr. Shaw. All right, we have hit time for questions. I do want to close on one last question, and I want to thank Dr. Shaw and Clint Osborne from HCMA. Clint, sorry we didn't get to get any questions, but I know we had a lot of questions related to the vaccine today, which we were excited about. The last question that I just want to close out with and draw attention to is just the question related to how many vaccines have been administered in the district thus far. We have begun reporting vaccination data on coronavirus.dc.gov/data. You will see the vaccinations tab where we will be, every week on Monday, we will be posting that data for the district. And as you can see there, 16,989 doses have been administered in the District of Columbia as of the 4th of this month. So the next update will be next Monday. So you can stay up to date on the vaccination data by going to the data tab on coronavirus.dc.gov, as well as other our daily metrics on coronavirus. Again, want to remind the website has all information related to phase 2. We have the full vaccination plan and timeline also available on coronavirus.dc.gov. So just want to make sure that everybody is reviewing that information, familiarizing yourself with that information, and based on the community call where we were getting a lot of questions about asking us to provide that vaccination data, we have done that, and that is available at coronavirus.dc.gov/data. So again, I want to thank our speakers for joining us this evening. I want to thank you all for joining us and for your great questions. Next week, we will be joined. Our call will be at our regular time, which is Wednesday at 5 p.m. So we hope you will join us. Same phone number next Wednesday at 5 p.m. Thank you so much, and we will talk to you soon.